Did you know that 1 in 2 postmenopausal women struggle with dryness and pelvic heaviness? Yet almost no one tells you that your body still has a natural way to ease these symptoms. The question is, can daily self-pleasure actually protect your uterus, or is it just a myth? Hello, I'm Dr. Eliza Hart, a board-certified gynecologist with more than 15 years of experience caring for women through menopause and beyond. I've sat with thousands of women in their 50s, 60s, and 70s, many of them whispering the very questions you may be too embarrassed to ask. My mission is simple: to give you clear, evidence-based answers so you can make informed choices for your health. The reality is that after menopause, your uterus doesn't just switch off. Estrogen levels drop by more than 80% blood flow. Slows tissues become thinner, and symptoms like dryness or heaviness appear. Yet few women are ever told how much these changes can impact their overall well-being, not just intimacy, but bladder health, pelvic strength, and even sleep quality. The silence around this topic has left too many women confused, isolated, and misinformed. In today's video, I'll show you exactly what medical research reveals about daily self-pleasure after 60, what's truly beneficial, what's just a myth, and how this simple practice could become a safe part of your wellness routine. If women's health after 40 matters to you, hit the subscribe button now and type a 1 in the comments, so I know this is the kind of conversation you want more of. And please help me reach my very first 1,000 subscribers so this channel can continue to grow and reach more women like you. 1. The uterus after 60 and the role of circulation. Many women believe that once menopause arrives, the uterus becomes irrelevant, almost as if it no longer matters. That assumption is not only misleading, but also harmful because the uterus continues to influence pelvic stability, bladder control, and overall comfort well into later life. This is why it is crucial to understand what really happens to the uterus after 60 and why circulation plays such a decisive role in protecting its function. From a medical perspective, menopause is marked by a steep decline in estrogen on average, more than 80% compared to reproductive years. This hormonal loss sets off a chain of biological changes. The uterus, which once responded monthly to hormonal fluctuations, begins to shrink slightly in size, a process called uterine atrophy. The lining thins, blood flow decreases, and surrounding tissues may lose elasticity. These changes can contribute to dryness, pelvic heaviness, or discomfort that many postmenopausal women quietly endure but rarely discuss. While these symptoms are not dangerous in themselves, they affect quality of life and can increase the risk of urinary issues or pelvic floor weakness if left unaddressed. What many women are never told is that circulation, the movement of oxygen-rich blood through pelvic tissues, remains one of the most powerful protective forces for the uterus. Adequate blood supply nourishes cells, supports tissue repair, and maintains muscle tone. When circulation diminishes, tissues are more vulnerable to thinning, inflammation, and reduced function. Think of it this way: just as your heart or brain requires steady blood flow to stay strong, so too does your uterus, even long after childbearing years are over. Here's where intimacy comes into the discussion in a very clinical sense. During sexual arousal, measurable changes occur. Heart rate rises by 20 to 30%, pelvic arteries dilate, and blood flow to the uterus, and vaginal tissues can double or even triple compared to the resting state. Studies published in the Journal of Sexual Medicine have documented that women over 55 who maintain some form of regular sexual activity, including self-stimulation, show significantly higher pelvic blood flow than women who remain inactive. This finding matters because increased circulation does not just improve comfort, it directly supports uterine health by supplying oxygen and nutrients to tissues that would otherwise remain undernourished. In clinical practice, I have seen women in their 60s and 70s describe a sense of heaviness or silence in the pelvic area. When encouraged to adopt safe, gentle habits that enhance circulation, whether through physical activity or sexual stimulation, many reported improvements in comfort, energy, and even confidence. While each case is unique, the biological principle remains the same. Circulation is life for the uterus. By keeping blood moving, you are keeping tissues active, responsive, and healthier than they would be if left idle. As we move forward, it becomes equally important to consider not only the role of circulation, but also the complex hormonal responses that occur during self-pleasure. These chemical messengers released by the brain and body bring another layer of protection and healing that most women have never been informed about. 2. Hormonal responses to self-pleasure. One of the most overlooked aspects of postmenopausal health is the fact that hormonal activity does not stop entirely after the final menstrual cycle. Many women assume that because estrogen and progesterone levels fall, the body is left without any meaningful hormonal support. This belief often leads to resignation, accepting fatigue, sleep problems, and persistent discomfort as inevitable. In reality, the body continues to produce powerful chemical messengers during sexual arousal and climax, and these hormones can have remarkable effects on both the uterus and overall well-being. The first and perhaps most significant hormone is oxytocin. Known in clinical literature as the bonding hormone, oxytocin surges during orgasm. While it is often discussed in the context of emotional closeness, its physiological role extends far beyond. In the uterus, oxytocin stimulates rhythmic contractions, which help maintain tone and improve circulation in uterine tissue. These contractions are not strong enough to cause pain, but they serve as a form of exercise for an organ that would otherwise remain relatively inactive after menopause. Oxytocin also lowers blood pressure, reduces circulating stress hormones, and has been shown to promote a sense of calm, a combination that benefits cardiovascular and uterine health simultaneously. Alongside oxytocin, the body releases endorphins, the natural pain-relieving chemicals often compared to morphine. For women coping with pelvic discomfort, joint stiffness, or even general aches associated with aging, endorphins provide measurable relief. Many of my patients have described sleeping more soundly and waking with less tension after nights when they allowed themselves intimate release. These experiences are consistent with studies published in Harvard Health, which have shown that sexual activity in postmenopausal women correlates with reduced cortisol levels and better quality of sleep. Lower cortisol means lower chronic stress and, by extension, less systemic inflammation, a factor known to impact uterine tissue health. A third player in this hormonal symphony is dopamine, a neurotransmitter central to motivation and mood regulation. Dopamine release explains why women often describe a renewed sense of vitality and optimism following sexual activity, even in the absence of a partner. This uplift in mood is not superficial. It has physiological consequences. A positive mental state is linked to improved immune response, lower inflammation markers, and greater resilience of reproductive tissues. Together, oxytocin, endorphins, and dopamine create a biological cocktail that functions almost like nature's own prescription. While none of these hormones can replace estrogen in its reproductive role, they collectively provide protection against some of the most common complaints after menopause: stress, poor sleep pain, and declining pelvic function. In a way, each intimate experience becomes a therapeutic event, strengthening the connection between the nervous system, hormonal balance, and uterine health. As compelling as these biological effects are, hormones alone do not tell the whole story. Equally important is the profound psychological and emotional impact that intimacy can have, especially for women who have been conditioned to see this part of life as finished. Understanding this dimension allows us to see how body and mind are inseparably linked in protecting health after 60. 3. Psychological impact and quality of life. One of the most striking changes I observe in women after 60 is not only physical, but emotional. Many patients tell me they feel invisible, as though society has quietly decided their season of intimacy has ended. That sense of fading identity can be as painful as any physical symptom. Yet medical evidence increasingly confirms what I have seen in practice for years. Intimacy, even when it is practiced alone, has powerful psychological benefits that ripple through every aspect of health. Research conducted by the North American Menopause Society in 2019 revealed that women who maintained regular sexual activity, including self-pleasure, reported a 27% higher level of psychological well-being compared to those who did not. These women were less likely to suffer from persistent anxiety or depressive symptoms, and they demonstrated greater satisfaction with life overall. From a clinical standpoint, this matters greatly because mental health is closely tied to physical outcomes. Lower stress levels improve immune function, stabilize blood pressure, and reduce chronic inflammation, all of which indirectly support uterine health. In my consultations, I often meet women who admit they no longer feel feminine or desirable. These feelings are not superficial. They affect self-esteem, social interactions, and even the motivation to pursue healthy habits. When these women reintroduce intimacy into their lives, something remarkable happens. They report feeling calmer, more confident, and more connected to their own bodies. That sense of ownership is therapeutic in itself. By affirming that their bodies are still worthy of attention and care, they step away from shame and reclaim a measure of vitality that cannot be prescribed in a pill. The biological explanation for this is straightforward. Sexual arousal reduces cortisol, the body's primary stress hormone, while simultaneously releasing hormones that promote relaxation and trust. The result is a measurable decrease in anxiety and tension. For women navigating loneliness, widowhood, or the challenges of retirement, this reduction in stress can be transformative. Better mood, better sleep, and less internalized stress all create a healthier environment for the uterus and the body as a whole. At this point, I'd like to pause and invite you into the conversation. Every woman's journey through menopause and beyond is unique, and your voice matters. If you've experienced a positive change in your mood, confidence, or daily comfort after embracing self-care in this area, I encourage you to share your experience in the comments. Your story could be exactly what another woman needs to hear to feel less alone. And if you haven't yet found the courage to take that step, feel free to ask your questions openly. This community is here to support you. Ultimately, the psychological benefits of intimacy are inseparable from the physical. A woman who feels calm, confident, and connected to herself carries less internal stress, which translates to a stronger immune system and healthier tissues. As we move forward, it is worth addressing a question many women quietly fear. Can this practice also reduce the risk of something as serious as uterine cancer? That is where the conversation naturally leads us next. 4. Uterine cancer risk and medical evidence. One of the most common and serious questions women ask me is whether daily self-pleasure can actually reduce the risk of uterine cancer. The concern is understandable. After menopause, the uterus can sometimes feel like an unpredictable organ, silent for months or years, yet capable of producing alarming symptoms, such as unexpected bleeding or cramping. For women with a family history of cancer, this uncertainty can be particularly unsettling. So what does the science really say? The most honest answer is that we do not yet have definitive clinical trials showing a direct protective effect of masturbation against uterine cancer. Unlike in men, where large studies have established a link between frequent ejaculation and reduced risk of prostate cancer, data in women remain limited. That said, the biological principles we do know point toward potential benefits. Circulation, cellular renewal, and tissue health are all factors that influence cancer risk, and each of these can be positively affected by sexual activity, including self-pleasure. When uterine and pelvic tissues are stimulated, blood flow increases, oxygen delivery improves, and cellular turnover is encouraged. This process is important because healthy circulation helps remove metabolic waste products that can otherwise accumulate and contribute to tissue stagnation. Stagnant tissue environments are known to be more vulnerable to abnormal cell growth. By contrast, a uterus that receives regular nourishment through increased blood flow is in a stronger position to maintain balanced cellular activity. Another important aspect is the role of stress and inflammation. Chronic stress elevates cortisol, which in turn suppresses immune surveillance, the body's natural defense against abnormal cell development. Studies have consistently shown that women with higher levels of stress hormones are at greater risk for a variety of conditions, including cancers of the reproductive system. Since self-pleasure has been proven to lower cortisol and increase the release of calming hormones, it indirectly supports the immune system's ability to detect and eliminate abnormal cells early. It is equally important, however, to keep perspective. No form of sexual activity can replace the gold standards of prevention and detection. Regular pelvic examinations, Pap smears, and ultrasound evaluations, when clinically indicated. These screenings remain essential, especially for women with additional risk factors, such as obesity, diabetes, or a family history of uterine or ovarian cancer. Self-pleasure should be viewed as a complementary practice, something that enhances wellness and resilience, but never substitutes for medical care. In my practice, I have seen women experience peace of mind when they understand this balance. One patient whose mother had died of uterine cancer carried a heavy fear for years. When I explained that while masturbation is not a cure, it supports circulation, reduces stress, and fosters a healthier uterine environment, she felt empowered rather than helpless. For her, the practice became less about pleasure and more about active participation in her own health. That psychological shift alone reduced her anxiety and allowed her to approach routine screenings with greater confidence instead of dread. What this tells us is that the benefits of self-pleasure extend beyond the immediate. They touch on long-term health, on resilience, and on the way women perceive control over their bodies. Still, nothing illustrates these principles more vividly than real experiences from women who have integrated this practice into their lives. In the next section, I want to share a clinical case that demonstrates how theory meets reality. 5. A clinical case that brings it to life. Behind every statistic, there is a human story, and sometimes a single case illustrates what medical textbooks cannot. Several years ago, I met a woman in her early 60s who had been struggling with persistent dryness, pelvic heaviness, and restless sleep. She carried a deep sense of embarrassment, believing that her body had lost its vitality and that nothing could be done. Her fear was compounded by the fact that her mother had passed away from uterine cancer, leaving her with constant anxiety about her own health. During our consultation, she hesitantly asked if self-pleasure could be harmful. Instead of dismissing the question, I explained the physiology, improved circulation, hormonal release, and stress reduction. I reassured her that when practiced safely, self-pleasure could actually support uterine and overall health rather than damage it. Encouraged, she agreed to gradually reintroduce intimacy into her life on her own terms. Over the following months, her feedback was striking. She reported less dryness, reduced heaviness in the pelvis, and more consistent sleep. Most importantly, her anxiety decreased. She described feeling more alive and expressed that for the first time in years, she no longer saw her uterus as a source of fear, but as a part of her body still worthy of care. This case is not unusual. It demonstrates how addressing silence and stigma with knowledge can transform a woman's relationship with her body. While science provides the framework, lived experiences reveal how theory translates into genuine improvement in daily life. And once women feel empowered by both knowledge and experience, the next logical step is learning how to practice safely and consistently, a subject I always emphasize in practical guidance. 6. Practical guidance for safe practice. When I speak with women about the benefits of self-pleasure, one of the first concerns that arises is whether it is safe. Some worry about infection, others about overuse, and many are simply unsure how often is too often. These questions are not trivial. They highlight the need for clear, medically sound guidance that respects the realities of a woman's body after 60. The first principle is frequency. There is no universal number of times per week or month that applies to every woman. The goal is not to meet a quota, but to maintain comfort and consistency. For most women, engaging in self-pleasure a few times per week is more than enough to stimulate circulation release, beneficial hormones, and maintain tissue health. What matters is that the practice feels sustainable and does not cause discomfort. For some, that may mean daily. For others, once a week is sufficient. The emphasis should always be on listening to the body's signals rather than forcing a rigid routine. The second principle is hygiene. Proper hygiene reduces the risk of infection, which can be a greater concern after menopause because of thinner tissues and reduced natural lubrication. Washing hands thoroughly before and after, using clean devices if chosen, and ensuring the genital area is well cared for are all important steps. Some women benefit from using water-based lubricants to prevent irritation, while others may need a topical estrogen cream prescribed by a physician to restore elasticity and comfort. The key is to avoid products with harsh chemicals or fragrances that may disrupt the vaginal microbiome. The third principle is moderation and attention to comfort. While self-pleasure is safe-aggressive or prolonged stimulation without adequate lubrication can lead to micro-tears in fragile tissues. Gentle, mindful practice is not only more comfortable, but also more beneficial for circulation and relaxation. If pain occurs during or after, it is a signal to pause, and if persistent, to consult a healthcare provider. Remember, pleasure should never come with pain. A fourth point to consider is integration with overall lifestyle. Self-pleasure is most effective as part of a comprehensive wellness routine. Combining it with physical activity, balanced nutrition, and routine checkups creates a holistic approach to post-menopausal health. For instance, incorporating foods rich in omega-3 fatty acids and phytoestrogens supports hormonal balance, while gentle exercises like yoga or walking enhance pelvic strength and circulation. This synergy magnifies the benefits of each habit. Finally, the most important advice is to remove shame from the practice. Too often, cultural messages make women feel that intimacy after 60 is inappropriate or unnecessary. This stigma prevents women from embracing a safe, natural, and beneficial aspect of health. Reframing self-pleasure as a form of self-care rather than indulgence allows women to engage without guilt, leading to better consistency and greater overall benefits. Practical guidance is not about prescribing strict rules, but offering reassurance that this practice can be safe, effective, and deeply supportive of health when approached with care. And as we move toward wrapping up our discussion, it becomes clear that the true value of self-pleasure lies not only in circulation hormones or safety guidelines, but also in how it helps women reclaim dignity, confidence, and vitality in their later years. As we come to the end of this discussion, let me leave you with a clear perspective. Daily self-pleasure is not a replacement for medical care, but it can be a valuable addition to your wellness routine after 60. We have seen how it stimulates circulation, bringing fresh oxygen and nutrients to the uterus and surrounding tissues. We have explored the release of oxytocin, endorphins, and dopamine hormones that lower stress, improve sleep, and strengthen resilience. We have also acknowledged its psychological benefits, helping women regain confidence, reduce anxiety, and reconnect with a part of themselves that society often tells them to ignore. My professional advice is simple. If you are comfortable, consider self-pleasure as a safe, natural form of self-care. Pay attention to hygiene, use lubrication if needed, and always listen to your body's signals. Combine this habit with regular physical activity, balanced nutrition, and scheduled checkups such as pap smears and ultrasounds. When approached thoughtfully, this practice can improve not only uterine health, but also your overall quality of life. Above all, remember that age does not diminish your right to feel whole, vibrant, and cared for. Your uterus may no longer prepare for pregnancy, but it still plays an important role in your well-being. By giving it the attention it deserves, you are affirming that your body remains worthy of care at every stage of life. Thank you for spending this time with me today. If this video gave you clarity or comfort, please give it a like so more women can find it. Share it with a friend who may need this message and leave your thoughts in the comments below. I read them all. And if you haven't already, subscribe and help me continue creating honest, empowering health content for women over 40.